I am very pleased to introduce our presenters today, Lisa Dawson and Barb Kirby, who are joining me now, and they will be presenting on today's topic. Lisa's advocacy in long-term care was sparked by her experience supporting her father as a resident. She began by chairing his care home's family council and went on to co-found the Vancouver Coastal Association of Family Councils, helping to build and support councils across BC. Lisa now serves as president of the Independent Long-Term Care Councils Association of BC. That's the ILTCCABC that you will have seen referenced, where she brings regional concerns to the Ministry of Health. Her work reflects a deep commitment to involving quality of life and amplifying the voices of residents and families. Also joining us today is Barbara Kirby, whose advocacy in long-term care is rooted in over 15 years of supporting her parents. She co-chaired her father's family council and gained firsthand insight into the challenges families face. Barbara has since trained in dementia care, conflict resolution, and leadership in aging. She's worked to raise awareness of elder abuse through BC's community response networks, and now also serves as a long-term care advocate and certified professional consultant on aging. Barbara also advises the Vancouver Coastal Association of Family Councils, where she continues to champion dignity and informed choice for seniors and their families. Welcome to you both, and thank you so much for coming to share with us today your insight on how we can use our voices to increase quality of life in long-term care.
Thank you, Lori. So the underfunding is longstanding and has been an issue forever. So it's really something that we need to face and deal with. The long wait lists to access for care have been just unthinkable, and they're getting worse. So with, of course, the aging population, it's very necessary that we work on those wait lists. Inadequate resources, allocation to meet growing needs. There's just not enough money to go around and to be put into the right places, and limited aging and facilities with inadequate environments. I mean, there's so many old properties that need updating and just are not suitable for today's standards. And then, of course, the outdated models of care, including staff and resident ratios and the holistic training. All these things adding up are just not where we today in our society want to be living and being cared for. And when we think about it, this is a place where our friends and families and ourselves may end up living. And is that what we want for ourselves? Is that what we want for our loved ones? I would say no.
Thank you, Barb. The Independent Long-Term Care Councils of BC vision is quite different. Our vision is that the quality of life, person-centered care be the lens through which all service delivery decisions are made in long-term care homes in BC. We know that through your work with the Alzheimer's Society, you may be familiar with what a long-term care home is. You may even know someone who's passed through long-term care. But what might be lesser known is the role that the family or friend caregiver plays in supporting the resident in care through a family council. For the reasons that Barb has listed on this slide alone, long-term care has not kept up to meet the growing needs of those who need it, those who work in it, and those who are caregivers to those within it. It is an outdated and underfunded model of care. Despite all this, our organization focuses on what we have influence over. That is the individual care home relationship between the resident, family, and staff by way of collective voice in councils. This presentation focuses on what we can do with what we already have, and that is our voices. We hope that this slide sets a sense of urgency around accessing long-term care and also sets us up to discuss further our advocacy and our vision for a new model of long-term care. But first, who am I to speak about this topic? Lori did a terrific job of introducing me, probably better than I am just now, but I'll add some more detail. Yes, my journey did begin in the community in 2000 when I became my father's caregiver. He lived with me as I raised my daughter as a single mom in a 2-bedroom apartment. The 3 of us lived there until we could no longer find or access community supports to enable my father to live safely with us. And so he entered long-term care. That was 14 years ago that he entered long-term care. It's been my second home ever since, and the care team have become my second family. My perspective is one where for the first 5 years in long-term care, I was without a family council. I actually didn't know that the term existed. There was not a welcome mechanism of communication between resident staff and families. And so 9 years ago, a family council was formed, not by myself, but I quickly learned about it and I quickly attended and I never looked back. This was a welcome pathway of communication that helped deepen relations and open doors for significant resident quality of life improvement. I'm a strong advocate for long-term care reform for the sake of our residents' well-being and also that of our healthcare workers. I'm chair of my father's care home family council. I have been since 2018, and chair of the Vancouver Coastal Association of Family Councils, which we will describe more about their role in a little while. And yes, I'm the president of the umbrella association, the registered nonprofit association of family councils called the Independent Long-Term Care Councils of BC. Barb?
Okay, well, my story is a little bit different, but I also was caring for my parents over a 15-year period. And I know that 15 years in long-term care is becoming more and more common. But where we see that is where there's family to support the loved ones in long-term care. So it was for me, it was a great journey. I supported both my parents in long-term care. Mom had Lewy bodies dementia, and she was on the North Shore. And Dad had a brain injury, and he was in South Vancouver. So I was kind of the ping pong ball in the middle, going back and forth. And that was from 1993 to 2008. So that was quite a while back. And I served, and actually there was no formal association in those days, but we were talking about it, and I served as family council chair and co-chair in my dad's care home, but there was no mechanism to communicate really as we are today. We'll talk about that more, of course. That caring experience shaped my lifelong passion for improving the quality of life for seniors. The things that I saw were just so triggering and shocking, and just such, it was just, as you've all experienced, I'm sure, it's not easy, and we were not prepared for this. After my parents passed away, I launched a niche business working outside of the system as a private navigator and coach. I wanted to be able to cover all the barriers and gaps that I experienced when my parents were alive, just to help individuals prepare for later life and make them aware, and help them know that they have personal choices for later lifestyle planning while they're alive. It's not about end of life, or it's not about after life. I met Lisa while working with a client in long-term care in her dad's care home, and she invited me to volunteer on the board with Vancouver Coastal Association of Family Councils, which is one of the smaller regions under the umbrella of ILTCCABC. It was completely aligned with my values, and today I'm proud to serve as an advisor to VC, Vancouver Coastal Association of Family Councils Board, and continue advocating for dignity, transparency, and support in long-term care. It's so important, and I have really great hope that it's going to happen, and it'll be what we want to see. Thank you, Lisa.
Thank you, Barb.
Okay, so learning outcomes. Okay, here we go. Okay, so welcome to Nothing About Us Without Us. We serve as volunteers. The purpose is to increase the quality of life and long-term care. With that, we already have our voices, and that's what we use. Now, here's 3 learning outcomes that we're going to focus on today, and I'll just read this here quickly. A better understanding of the new role of family caregivers in their advocacy and impact through family councils. So family caregivers can raise their voices as advocates and have a great impact. Understanding how councils can contribute to quality improvement, making life easier for residents, families, and for the staff. So it's a circle. It really is a circle of support. Our stories of coming together, many of us caregivers to family living with dementia, and what we do as a volunteer organization. So there'll be stories throughout and experiences. Go ahead, Lisa.
So long-term care has always been a stay in your lane and we will stay in our system, which limits engagement. The engagement level has always been sort of a one-way informing town hall kind of style communication or public consultation at best. But our grassroots organization has really influenced a change in the role of family caregiver. We are now at the co-creation stage, or a later and a more integral stage of engagement. The family caregiver and residents themselves now have an engagement mechanism called the Resident and Family Council. There are variations of how they appear, and we'll get into that in a little bit, but typically there's either a resident council or a family council or a combined. This presentation identifies the effectiveness of long-term care councils, how these effective councils contribute to continuous quality improvement, and this mechanism of communication itself has become an improvement, making life easier for the entire care home community because there is now a channel of communication. In addition, we hope to share a story about how our grassroots organization began and how those living with dementia are such a large part of our conversation. We appreciate learning from all of you at the Alzheimer's Society. You provide us resources and insights on how we can improve in the role that we play as a family caregiver to those living with dementia.
So long-term care, family caregivers history before COVID, we were feeling isolated, frustrated, no mechanism for communication. Every resident and their family was for themselves. There was no group or team effort. There was no education on how to be a family caregiver to someone in long-term care. And there is a certain protocols, there are certain protocols and better ways to communicate with a very busy staff and people that have to follow their own protocols as well. So, and the other thing was that a lot of times there was no knowledge of what was coming next for our family members. And it was a horrible feeling being in the dark. So here's what I saw before COVID. And I'm looking at this from a systemic perspective, but also as a family member too. So before the pandemic, many long-term care homes operated with what families called a closed door culture. Families often felt like unwelcomed outsiders with little opportunity to communicate or even take part in their loved ones' care. Without guidance, they had to navigate a complex system on their own, often in the dark, about how best to support their loved ones. When concerns were raised, homes frequently reacted defensively. Staff felt blamed. Administrators were often unavailable, and responses came back as rigid rules rather than solutions. So, as much as we are struggling and trying to communicate with them, they want to help. A lot of times I'm saying this now, but they felt defensive and blamed. This created a them versus us dynamic, and that eroded the trust. And we just didn't know better back then. For families, the experience was exhausting. Complaints to health authorities and patient care and quality control office about problems in care rarely led to timely or meaningful outcomes. Many families gave up, worn down by the process. And I had experienced that with people, in long-term care. I didn't have to deal with it personally, but other family members certainly did, and it was just really so tough. And I'm sure it still happens today. This culture left residents and families feeling silenced, unsupported, and grieving, not just for their loved ones, but for the loss of dignity and humanity that should have been central to care. The COVID-19 pandemic exposed these weaknesses with devastating consequences, but it also became a turning point for reform in long-term care and a blessing in disguise. Lisa, do you have anything to add there now?
No, it really takes us to the next slide, that Barb has basically covered, in the sense that, so there is before COVID, now during COVID, there is policy making without engagement of the stakeholders to whom these policies directly affected and had devastating effects. So as Barb alluded to, the family caregivers were locked out, single site rules and other decisions drove staff out and away, and basically, we all know the horror stories that occurred thereof. But it was this experience of COVID that really fueled the family caregivers to find a better way of doing things. And some family councils actually took matters into their own hands. Where there was not enough staff, they started to hire companions. One care home actually created a companion program. And so there are, out of the depths of challenge and tragedy, there has risen, like a phoenix out of fire, essentially, our organization. Barb?
Okay, and then came the opportunity after COVID with a remarkable milestone. But first, a short history of family councils and Independent Long-Term Care Councils Association of BC, ILTCCABC. The grassroots movement began on Vancouver Island. Family caregivers and long-term care homes founded the Vancouver Island Association of Family Councils. While formally established in 2010, their presence stretched back to as early as 2000 and even earlier. As I say, when I was running family council in Vancouver, but we weren't connected yet. So as early as 2000, they were meeting, sharing, networking, discovering, and connecting with their health authority, Vancouver Island Health Association, Health Authority, to advocate for change in long-term care. Momentum spread to the mainland, and in 2021, families in long-term care across the mainland and throughout BC began forming councils. Together, we connected with the Vancouver Island Association, shared experiences, organized and established 5 regional associations of family councils, 1 in each health authority region throughout BC. It's an amazing, I feel so proud of that accomplishment. And then a provincial milestone. By 2022, these regional associations united to register as a provincial nonprofit society, the Independent Long-Term Care Councils Association of BC. And again, the acronym ILTCCABC. Thus began a new chapter for family caregivers. The legislation had already been established that long-term care homes were required to advise families and residents of the right to establish family-led family councils in their long-term care homes. Now we have the mechanism to support that with ILTCCABC, the provincial family councils. For the first time, family voices could now be elevated, their concerns respected, and their collective knowledge harnessed to collaborate on real improvements to residents' quality of life, not just for their loved ones, but for the entire care home community, including residents, families, staff, and executive. Lisa?
Thank you, Barb. I have one more bragging point that really just came about recently, and that is to say that we do have limited funding now from our Ministry of Health to do this good work, so that we do have, this is actually a slide of our website, our main website for the ILTCCABC. You'll see that there's an education portal on there where all of our member family councils, or even families who don't have councils, can register for free, go in and find resources. It's expanding daily, actually, but we hope to continue to keep this portal alive with current and relevant resources to aid our families and family councils during their journey. We now have a place to house our news items for various sessions like today, and even media releases when we have the opportunity. But first of all, backtrack a little bit. For those of you who've never heard of a family council, what is it? So a family council, basically, a resident or a family council, is a group of people that meet regularly within the care home community to promote the collective interests of residents and to discuss issues of concern. Councils may include residents, family members, and other representatives who act on behalf of residents. In long-term care homes, a family council is a group of people who meet to discuss how to improve residents' quality of care and quality of life. Moving into a long-term care home, as we know, is a major change accompanied by a loss of what is familiar and comfortable. Both residents and their families, friends, or other caregivers go through this experience. Now we have councils. They offer a sense of a community within a community. They offer a social hub like they once might have had in the community at home. The family council is a safe space to share experiences and ask questions that you might not be able to share, or find someone to answer your questions for you. Yet you know when you come to these family council sessions that you are not the first person or the only person to be having the same conversation. These conversations, when they take place at a family council meeting, however casual or structured they may be, these conversations are captured, prioritized, and raised to management in the care home for actionable outcomes of improvement to resident and family experience. So this is what a family council is within the long-term care home setting.
And in order to understand how councils can contribute to quality improvement, making life easier for residents, families, and staff, we have to look at what does a family council do. So there's 5 key areas here where we provide the support. And so it includes encourage and support, offer support to families and family caregivers, residents, and staff, really. We help deepen relationships, we problem solve, communicate and educate. A lot of times in problem solving, of course, and you probably know this, that we can solve the problem easily once we know what the root of the problem is, and so things can be simplified rather than escalating some of the problems. We communicate and educate, and we advocate. And I like to call it practicing gentle advocacy. So where we come up with solutions that support everybody. And so we share experiences and observations for the purpose of improving residents' quality of life. And we offer peer-to-peer support, reducing frustrations and feelings of isolation. We get to know staff and management and have regular meetings to share the collective voice, recognizing what is working well and celebrating that. Lisa? Do you want to add?
Yes, we'll go through each of these items, but I just wanted to embellish Barb's list here and add to that to say that we do contribute to decision-making that affects residents and their families. We educate families on important matters as well that they're interested in, such as advanced care planning, resident health challenges, and the long-term care home that they're in the system in BC. And as Barb mentioned, we offer support at the regional level and provincial level through our advocacy. So we'll start with going a bit deeper into the first one about encourage and offer support.
Without a family council, experiencing situations such as unnecessary hospital trips, falls, or a loved one being triggered by a person or time of day, for example, inconsistencies in personal care, as well as something as simple as lost laundry, are all common experiences that can seem like they're insurmountable challenges in long-term care when families have no support. As family or friend caregivers working alone, we can become stressed when we hit a dead end, trying to resolve individual issues. Shift changes and no complete answer to why or when something happened to our loved ones. So not taking responsibility from one shift to another. Responses such as I wasn't on shift, then leaving us feeling lost. We feel frustrated and embarrassed, thinking that we are the only complainers, and we worry about retribution. Lisa?
Yeah, so without a family council, Barb has painted a bleak picture. Like she said, a blank, dead end wall. But with a family council, this informal grassroots mechanism of meeting, we listen to each other. We determine whether the issues are individual, in which case, as a council, we guide and mentor into who they might be, who they might contact within the long-term care home. Are they aware of the process of a complaint process? And it might just well be that they haven't connected with the right care team member to get their problem solved. But we determine whether they're collective issues. If everybody's head nodding and adding their own experience and observation, then this is where the joy in this council begins. We start to ask questions and be curious as how this problem could exist in the first place. We try and unwrap it the best we can. And then at that point, we can take our discussion to our senior leadership team meetings, our management meetings, whoever is our point person for meeting with. And what's really great is we can continue to unpack, peel back the onion, and as Barb said, find the root cause so that we can actually problem solve together. And it's a really great way to get through concerns and also raise ideas for new items or new projects that haven't even come through the care home. So, but one of the things we wanted to mention is that the challenges of long-term care for residents are largely around the concerns we have with the residents diagnosed with some form of dementia. 85% of our residents in long-term care are diagnosed with some level of cognitive disorder. So we are very highly attuned to, and our conversations revolve around how to make life better for residents who have been diagnosed with dementia. Barb, do you want to talk about a couple?
Yeah, so one of the ways we focus on this is managing responsive behaviors. Seniors with dementia or other mental health issues may exhibit unusual behaviors, and it could be aggression, it could be anxiety, it could be so many different things, which can be challenging for staff to manage effectively, and especially with limited resources and time. And it can be stressful if it's in a group situation or other residents are around and there are vulnerable people around. So what might be causing triggered responses? This is always, there's always a root to the problem. And I think that's where, we're making great inroads on learning this. And I'm sure you're aware of it too, that what is triggering the responses. And it just makes such a difference, helping staff to get to know each resident as a whole individual with past life experiences will go a long way in reducing stress for staff and help maintain a person's dignity while feeling respected and comfortable and at peace, as opposed to unwittingly being unbeknownst to them, they're going to be triggered by something and creating a scene possibly. Lisa?
Yeah, another way we, help one another and encourage support is by, as I mentioned before, getting our own training, our own education. But we also, during that process, can offer our staff individuals that we've come across who are great speakers, trained in their field of managing behaviors, and also such topics as we've done before. We recommend always to staff to invite Alzheimer's Society to come in to help present, invite dementia solutions, invite someone to speak like Lorraine Mock on dignity care. And of course, Deborah Batke and her Spark cards, which are great for huddles. So through our exchange with other family councils in different regions, we found ways that other care homes have adopted their own training to meet the time restraint demands, personnel training time demands, meet them where they are. Is it in their huddles? Is it in their 30-minute staff short training sessions that they often have? Where is it best that we can help them help themselves? Anything else, Barb?
Addressing these challenges requires developing dementia-friendly care environments, creating environments that are safe, stimulating, and supportive for residents with dementia, implementing person-centered care approaches, focusing on individual needs, preferences, and strengths, rather than solely on the dementia diagnosis. And of course, these have been developing as well for a long time, but as a family council, we are able to be the voice to make these changes when sometimes there's such a slow response by the home.
Right, I jumped ahead. So the next point is we'll try and demonstrate a little bit about what it's like without a family council and what it's like with a family council in terms of deepening relationships and influencing a relational approach to long-term care. So family councils do help deepen relationships between residents, family, and long-term care staff by fostering a mutual understanding and support. This is where we need to hear from families with more complicated dementia issues and those living in special care units collectively. We want the full voice and the spectrum of residents in the long-term care community so that together we can make a difference and make a change if the same problems are happening in more than one home in special care units. We can actually raise that to the health authority through our conversations with them as well. Without a family council, as families, we tend to reach out to the closest staff person or management person, whoever is near us, tap them on the shoulder, ask them a question, and bring up our concern. And we're often met with, "I'm sorry, we don't have enough time for this right now," or we present our problem with already heightened emotions, and that might be off-putting to the staff member, and put us on the defensive. And the outcome of that is that the problem that we have doesn't get resolved, actually doesn't even get heard, doesn't get discussed, so therefore it doesn't get resolved, and then you're labeled as a difficult family member. It's really important in family council that we develop relationships, and our Regional Association of Family Councils has tools for that. We talk about an appreciative inquiry approach to conversations. Barb has actually on her own website an article on gentle advocacy. It helps us help ourselves to set the tone of our conversations that we're having.
And so examples with a family council, and some of this might be repeated, but with a family council, family members have a community to turn to for questions, support, and guidance in an approach that is helpful. Maybe others are having the same problems, and knowing how to approach the staff and the problem is really the key. Councils invite staff to family council meetings to share what they do and answer questions, and maybe to talk about what their barriers and blocks are. So in a way, we can help make it easier for them from that perspective too. Family councils seek out families from all areas of the care home. For example, even the special care units or memory care, to elevate the voices of those who are not visible. And we really hope that the special care units and memory care can have a well-heard voice as well. And family and resident councils are breaking down barriers and influencing a new culture. It's a wonderful thing. From institutional, transactional, clinical, task-based, and administrative care to home-like, relational, intentional, and personalized care, just like home, using a mindset of continuous quality improvement rather than it's always been done this way.
I wanted to add one more thing too. It just popped into my mind about family councils deepening relationships are always on the lookout for residents that do not have any family. And we are constantly trying to find ways where individuals without any representation can be identified and included in a special way, if not going to a resident council meeting, having the opportunity to have one-on-ones with staff. Here's a great one. This slide alone depicts a perfect example of how we problem solve. Barb, did you want to start on that one?
Well, I'll just quickly go through the points here, and it's about identifying issues, which we'll talk about here in a second, learning about the current processes and providing recommendations, discussing solutions with management, celebrating successes, and to advocate for continuous quality improvement within the long-term care home. And sometimes dietary issues tend to be a problem, and they need to be addressed over and over again. And if you look at this example here, and this is, we'll say this is without a family council to support, the top picture is an example of high starch. It's chickpeas, mashed potatoes, and fake potatoes, and rice. And can you believe that was actually a meal for residents? And so it's just all starch. And it's not using the five senses of creating the meal. So the smell, the touch, texture, taste, you really don't get any of that with this plate. Snack time and lack of nutritional value is a problem, and the Dementia Food Guide says that you need a balanced diet, and that includes at snack time as well. So you would have fruit and cookies, or whatever, but a combination of things that are considered healthy and nutritional.
Exactly. So these photos are actual photos from my dad's lunches, to be honest. That's where these ones came from. And so as a family council member, I'm constantly taking photos or actually taking the plate if necessary to our director of food services or to the kitchen, but the director of food services most importantly. And I just want to say that this process works, having a family council, because as you can see in the picture below, yes, my dad has a soft food diet, but below you can see that it's like egg omelet. There's color in the form of carrots inside the scrambled egg mixture. Believe it or not, that green stuff there was absolutely incredibly tasty. It's real spinach. And then the other one was real mashed potato. And in this particular case, they made potato leek soup from scratch. And so not only was the meal served at the right temperature, it looked good, it tasted good, there was variety and choice, and it was also very nutritious. So I'm super happy about the way councils are able to communicate now in long-term care to make a difference. But it is an ongoing process of continuous quality improvement. So what else do? We communicate and advocate, or sorry, communicate and educate about care home policies and procedures, about issues relating to residents, as we mentioned, in the long-term care system, whether it be dementia, diabetes, food, recreation, and how to influence change based on common ground, always entering the room with those that we speak with, with the conversation being that we're meeting here today for the resident well-being. So once we know that we're all here for the common good, the conversations are much easier to explore. But without family council, there is no education to family regarding care home procedures policy. Policy they have to learn on their own accord, and most families don't even know that they're entitled by regulation to ask for a policy from management. So those are examples of family council and our work and what happens without a council.
And with a family council, they provide support, which Lisa talked about and we've talked about. They can provide the policy and procedures handbook, which are unique to the home for new residents and families. And a lot of homes don't even have a policy and procedures handbook, but it comes in really, really handy. And family councils can be instrumental in helping prepare a book like that, because often the staff won't have time to do that. So yeah, so that's it's very handy. Speakers, we'll invite speakers from the Alzheimer's Society. We're looking forward to that. And in-house care team support is another area that we focus on. We have well, in Lisa's home in particular, there is a group of caregivers that families can hire to provide extra support. So so that's really handy for families, and if there's not enough support, and also providing the care team that is working with the resident additional support and information, creating initiatives to improve the aesthetics of the environment, making it more conducive to supporting residents with Alzheimer's and Lewy body dementia and Parkinson's and high anxiety, such as what we're already seeing, sensory rooms and walking spaces, and offering familiar jobs to people, displays to touch of familiar tools and games and music. So these are all wonderful things, but a lot of the homes may not have this and need the support to get these types of options available to them. So yeah, Lisa, is there anything you'd like to add to that?
No, just the fact that this slide also includes a recent topic of awareness, education, and interest, and that is dementia care, making the most of your visit with those who have dementia. It's been a real sought-after educational topic because as family caregivers, it's hard for us to see our loved ones slip away in a manner that we really do not understand for the most part. And so how can we ourselves find joy in the time that we have with our loved ones? So education is really, really super important. And of course, not last nor least, but as a result of all the stories we hear and our care and passion for improvement in long-term care, we advocate. So we advocate for positive change within the long-term care home, the long-term care system, by participating in its respective regional association of family councils. So here's a picture I want to paint that at the local level, that's where Barb and I have been talking throughout this presentation, where we're elevating the individual resident collective voice to management of the long-term care home, making a difference. You know, one care home at a time is really at the local level. But now we have this opportunity through the regional associations and their forums that they have to elevate the voice, elevate the resident voice from long-term care home to the regional level. For example, the Vancouver Coastal Association of Family Councils, the Fraser Association of Family Councils, and so on. Those regional associations meet once a month at the provincial level. They have 3 representatives from each region. Those representatives come and raise the collective regional voice further to our provincial association of family councils. And it's at that level, the executive at the provincial level, where we report into our Ministry of Health. We report in about our successes and barriers to forming and maintaining councils. We report in our growth of councils, and we report in systemic issues where we feel Ministry of Health should focus on their action items for improvement and change.
And so without a family council, there was no way any person in long-term care could ever reach out to the health authority unless it were to complain to licensing and patient care and quality control. It was us versus them. There was no relationship.
And so an example now with family council is this mechanism of elevating the voice. Family councils as well in each health authority have an opportunity to raise their voice, both resident councils and family councils at the government-led regional resident family council network. We have 2 avenues for our council voice to be heard, where systemic issues in long-term care can be brought to the attention of authorities who have oversight and influence on decision-making.
So we have many success stories of family councils as a volunteer organization. Our core work is to promote councils in long-term care homes across BC, to support our member regional associations of family councils, and to advance the collective voice directly to the Ministry of Health. I think that's kind of what you said. Ensuring residents, their families, and representatives have a voice and decisions that affect their lives and help shape BC's long-term care system.
So this slide just simply summarizes that which we have already reviewed as our core work. And this slide, go ahead, Barb.
Oh, I was just going to say patient partner engagement is now in BC. It is now in BC, part of every health authority's research and healthcare setting strategic plan. Nothing about us without us captures the purpose of a council. To engage the resident and family councils in decision-making, nothing about us without us signifies that residents and families should be actively involved in the planning and implementation of policies and strategies that impact their lives. Lisa?
So just to read the top of this slide, we have legislated engagement. We do now have in regulation reference to all long-term care homes throughout BC being supported to offer information and education about councils, to help start councils, and help transition staff-led councils to self-led councils. This legislated engagement gives us permission to be curious like never before. Do not accept the status quo. Be the voice of the needs, wants, and wishes of your loved one and others without anyone in long-term care. Make a difference is really what we're all about, and be the change you want to see through family and resident councils, so that, like never before, there is nothing about us without us. Barb and I thank you for inviting us here today to share our work with you. We would like you and invite you to connect with us. This slide here in particular opens that up as well at this time. I think we'll be open for questions.
Great. Oh, thank you so much, you two. I was taking notes furiously myself, and there were some very good questions come in. Just going back to the very beginning, and you actually, one of the first questions that came in was around what family councils do, and someone wanted to hear specific examples of actual results. And how lovely that then the rest of your presentation, you did exactly that. Are there any other kind of specific stories that you would like to share that you didn't get a chance to? Something that kind of jumps out to you as a success?
There are so many. There's so many, but yes, I think personally, one of the best success stories I've heard, it's twofold. One is the family council relationship with the resident council, and that is to say, being a team. That is to say, sharing their minutes and what's on their mind with each other, even to the point of asking a resident representative from council to come to a family council meeting and vice versa. And to the extent where a family council can just make it their year-long mission one year to work on projects that family council is interested in. Sometimes family councils are interested in seeing change that the care home just cannot get to. That might be revitalization of the garden. It might be a redo of the library. It might be finding ways, because the care homes lost their access to a outing vehicle, finding ways that residents can get out. Family councils are keen and eager to do research and connect with other councils through the regional associations to look up what other councils have done to meet the needs of residents. We really try and promote not reinventing the wheel. But yeah, I think the cross-pollination of resident council and family council is very important.
And it's quite interesting when you receive a complaint from one home and it hasn't been talked about, and then all of a sudden, once it is raised, then the other homes say, "Oh yes, we had that experience too." I'm thinking specifically about rodents, right, in the long-term care homes and management of that, and it was quite surprising that many homes were having the problem, but there were solutions. So, yeah.
Great. Thank you. Great examples. And great example, Barb, of that power of elevating to a regional group and then to the provincial group. That's great. Someone asked, what about residents who have dementia but are just very passive? Would the staff just kind of ignore them because they're not doing anything aggressive? Is this something that a family council could address? I was thinking that it seemed to fit a bit into your where you had the 4 points, number 2 about deepen relationships and influence a relational approach to long-term care.
Can I speak to that a little bit, Lisa?
Yeah, I've got a point too, but you start.
Okay. Well, I think it's really important that that we do have shared discussions with the staff and education, and it's about knowing who the individual person is. Are they an introvert? Are they an extrovert before this all happened? And how much does that affect them? Or maybe they've changed anyway. Maybe they once were and have come out of that. But I think that really knowing the history of the person and what their triggers are, and why they've withdrawn as much as they have. We don't know. Are they in pain? Are they feeling embarrassed or fearful of things? You know, I'm sure these are discussions you've had as well, right? But I think you know, getting to know the person as an individual first and treating them as an individual is so important, even if we think they can't understand and if they're not responding. And I've often had response with song and a smile and a touch. And Lisa, what were
Yeah,
you
you
thinking?
just hit it on the nose. Our family council brought this to our leadership's attention, and really, recreation department now keeps a like a checklist on how many activities sessions each resident has been to in a week, and they can identify residents that are passive and um, may even be aggressive by being brought to a recreational activity. But Barb said it's about meeting the person where they are and looking for more ways to have person-centered recreation. An example of that in our care home was splendid. We had one care aide who played the ukulele, and she would go from room to room, and she was given a list of identified individuals who were not participants in group activities, didn't want to or couldn't. And the joy, like Barb said, through music, whether it's just watching their fingers and toes move or a smile on their face, is such a meaningful moment when you have met them where they are.
That's great. Thank you. How do we know? So this, I've heard a number of kind of variations on this. How do we know if the long-term care facility of our family member has a family council, and how do we contact them? What if there isn't one and the home doesn't seem interested in having one? Or another variation on this is there a list somewhere of long-term care homes that have family councils in place?
Aha, that's a really good one. Barb, can I just I'll start off.
Yeah, you go ahead.
So, good timing on that question. Number one, the Office of Seniors Advocate website has the long-term care directory. That directory, you can put in the name of the care home or the municipality, and the care homes will pop up. It identifies all assisted living and long-term care homes designated by an AL or an LTC. You can take a look at the care home of your choosing. There is a report, but more importantly, there's a database or data listing about a profile of that care home. Part of that profile is whether that care home has a resident and or family council. However, we have noticed as an organization that information is not always up to date. However, in speaking with Office of Seniors Advocate recently, who came to speak with us, they do update it quarterly. So they are about to update that directory. They're actually coming to speak to us late October about the directory itself. And so that'll be an open forum for people to come and learn about that directory. The best person to speak with inside your own care home is probably your receptionist or your social worker. But really, any resident-facing staff member should really know whether or not your care home has a resident or family council. So once you've learned whether you do have a council. Certainly, if there is an active council, you should be receiving notices, regular invitations to those meetings, whether they're virtual or in person or hybrid. A sure sign of a situation of concern would be if you're not receiving any notices at all. If your care home does produce notices and you're not receiving them, that is a sign that you should be seeing the social worker or the person in charge of that list, keeping that list up to date. But what if there is no council? Maybe there was at one time and there isn't now. That happens. And you're interested in forming a council. Would definitely approach the director of care. And if that's not the person that is the staff liaison for the council, maybe it's a recreation lead, maybe it's a social worker, or maybe you actually have a resident and family ambassador in your care home. Get in touch with the person in charge of supporting your council. If there is no person in charge, certainly you could ask for someone to be assigned to listen to your interest in starting a family council, because it's now regulation that every care home, every long-term care home in BC must offer at least twice a year the opportunity to form a council, to become educated, to have an information session. And so if the care home, can't afford the time, personnel, or even have anyone that's educated, you can always contact the Regional Association of Family Councils in your area. That is what we do. You can connect to us through the information here on this screen. At the provincial level, we have a map and it has every single region there. And you can connect with us to start the ball rolling. We will facilitate a meeting. It may be in person, it may be virtual, it may be hybrid. We're happy to work with a connection at your care home. But certainly it's every family's right to have, to get started, to get the information, and to decide whether this is something they want to move forward with. Long-term care family and or resident councils take various shapes and various sizes. There's no right or wrong way, except for to not have one or not get started.
That's perfect and fits very well. My next question, somebody posted, I have just accepted a family council co-chair position in a long-term care facility transitioning from staff run to family council. Help, where do I start?
Perfect. Call us. Depending on what regional area you're in, you would call your Regional Association of Family Councils. So if you're in the north, it'd be the Northern Association of Family Councils. Again, that's on this website at ILTCCABC.ca. Each region is represented there with the contact information. Each region has their own website. You can poke around and find resources and further information there. You can see who the leadership team is of that particular location. And you have connections at each. Feel free to call us, email us, whatever it takes, but we will make sure that you will be supported. That is what we do. That is what we do. And we're happy to hear that a care home is interested in transitioning from staff-led to self-led. And it doesn't mean you're cut off from support whatsoever. It's very clear in the regulations that the care home staff liaison be a person of the council's choosing, that they support you in distributing all your minutes and your notices and agenda, that they support you in giving you a place that's in print to post, let's say, on a bulletin board. Some care homes go as far as giving them a page on their website, but support is greatly lent, still continued and greatly lent by your care home. It just means that they're not setting the agenda, setting the time and date, setting the rules for your council, that you set your own. Some councils choose to meet as a small group in the community and take advantage of community connections, you know, having coffee at Tim Hortons or going to the White Spot for dinner. So some care homes only meet in person because it's at a time that it works for them, because a lot of them come to care as spouses for their loved ones. And others are the sandwich generation that can only meet in the evenings, maybe once every 2 months because of their crazy, hectic schedules. And they're all about virtual meetings. So they take it takes getting to know the individuals that you're working with and your demographics.
Fantastic. A few more things. Is there a requirement that long-term care homes have resident and or family councils? If not, why not? And why should the two be separate when they both have a common purpose and goals?
Yes, there is. Our slide, the remarkable milestone, actually represents that milestone where we were going about supporting and advocating for councils to exist in long-term care with some sort of support. And it was at that time, November 3rd, 2022, when the regulations were actually changed to ingrain councils in every long-term care home across BC. That doesn't mean a forced council. If there are no family members interested in forming one, then that's fine. It's about giving them the opportunity. Families don't even know for the most part, and families continuously change. So as residents move through long-term care, so do their families and loved ones. So it's not about a one and done town hall telling everybody, the families, that you can have a family council without explanation of what one is, or left to their own devices to read the regulations. It's about continuously bringing the opportunity up and supporting the opportunity. It's really about a change in the mindset of every long-term care home to start considering what engagement looks like with their family members. Maybe they have never surveyed their family members. Maybe they've never even had a town hall with families. Maybe they've never had an engagement process outside of family councils. You know, maybe they've never invited them to an in-person town hall to have an open forum exchange. So it's about starting the conversation.
Great. Barb, you mentioned sensory rooms and things like that, and you mentioned something about councils helping. So, how would family councils help homes gain access to additional tools?
Well, one of the things they could do is connect with the people that offer those tools and have them come in and give a presentation to familiarize the home and the families with what it actually does and how it can support people. And I think that would be the first step. And then strategizing where there might be space for that, and how many residents they have that would actually be able to use it, that it would be helpful for. And yeah, I think that's really where you would begin, is bring in. There's so many different tools that you know, maybe you would want to have them all in the same room. I'm not quite sure how that would work, but yeah, it's exploration, and as Lisa uses the term, being curious, and just bringing in as much information as we can.
Uh, the other thing that came up, would ILTCCABC help with policy and procedures manuals? Are there templates? You had, I believe, Lisa, you had a slide and talked about policy and procedure manuals.
Yes, the slide referring to policy was more relative to family councils beginning to be curious about the policies in their own care home. So, you know, smoking policy towards inviting your own physiotherapist in. What is your policy about oh, there's so many policies in a care home. I'm stymied at the moment, but it's about that. It's not about developing a policies and procedures manual for
Okay.
for the family council. The family council is really guided by two things. We want to keep it simple. It's really guided by a document that says who we are and what we do. That document tends to be called a terms of reference document, but it is a reference document that we have as a template. And we have 2 or 3 that we have right now that we use when we work with families who are starting councils or they're transitioning from staff-led to self-led. And then there's the other document that's very helpful that we promote called the Code of Conduct. It's a document that helps set the stage for really productive conversations within the family council at a time where families tend to come in highly emoted. How do you have constructive conversation? How do you lead a council if there's disruption of a single person usurping time? How do you de-escalate emotional conversations when you're with your management group? How do you do this? And what sort of things do you need to think about in this code of conduct before you enter the room and space? So what are the expectations that are set for your meeting? So those 2 documents tend to be simplistically your little manual. The rest of the questions that come along are answered by our organization. And as I mentioned, our education portal is growing. We are actually working on an A to Z, the first conversation to a whole appendix of tools. But there's a lot in there already, spurred by the questions and requests of family councils. So we are grateful for that.
Sorry,
I just wanted to mention that getting back to how do people find homes and that might have family councils or any other reference that they're looking for. There's another organization called Senior Services Society, and they have a whole housing section on their website, and it's a very useful tool as well. And you just put in your parameters, you know, they'll ask everything from, are you a smoker, a non-smoker, do you have pets, or, you know, whether pets are allowed in the homes, and you know, it's for assisted living and long-term care. So I'm not sure if they have private homes in there as well, but it is a very inclusive, quite an inclusive list.
Yeah, you can always call the regional association. We are working very hard to track our connections, to track the statuses of the care home councils. That's part of our mandate under our Ministry of Health. So we work very hard towards that. Is it perfect? No, because one day there might be a council and the leaders of that council have had loved ones pass, and they've chosen not to maintain affiliation or even advise on that council. And then, you know, sometimes they need help restarting.
Thank you so much, Lisa and Barb. This is such a powerful, powerful topic, and one that is so empowering for, it really struck me when you were talking about before COVID and now what we learned and now where we are. And so I really, really appreciate your willingness to come and share with our audience about family councils and resident councils, and very much that empowering idea of nothing about us without us. So thank you.
Thank you for the invitation.
It was a pleasure. Thank you.